A recent Kaiser Family Foundation survey found that more than one quarter, that's 26% of individuals, reported they would wait 4 months or longer to seek previously skipped medical care. As the COVID-19 pandemic continues, hospital volumes remain low and face persistent financial challenges. At the same time, hospitals and health systems are a critical source of care for COVID-19 patients, as well as other patients with chronic conditions. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer for AHA. Patient safety has always been the number one priority for hospitals and healthcare providers, and COVID-19 has not changed that one bit. In fact, the safety protocols put into place for patients, families, care providers, and staff since the pandemic's onset are the most stringent they've ever been. Today, we hear from Dr. Amy Compton-Phillips, Chief Clinical Officer of the Providence Health System.
Good day. I'm Akeem Demahin, Director of Policy for the American Hospital Association. With me today is Dr. Amy Compton-Phillips, Chief Clinical Officer for Providence, a health system that includes 51 hospitals serving 7 western states. Dr. Compton-Phillips, I know you're overseeing your system's response to the COVID-19 crisis, which arrived at one of your hospitals in late January. So thank you so much for taking the time to share your story with us.
Well, I really appreciate you asking, Akeem. I'm delighted to be here today.
Wonderful. If I might, let me ask with a broad question about what you've been seeing in terms of the patients who are seeking care during this pandemic that has disrupted all of our lives.
Oh, we're seeing so many things. It's a really broad question. So in addition to that first patient, we had the first set of patients here in our Seattle area. So not only individual who came from China, from Wuhan, China, but also patients who came from the Diamond Princess cruise ship and tested positive, came up to our special pathogens unit. And so we had early insight to how this was behaving, how the virus was behaving. But we also had early insight to how the community was behaving. And the community was scared of the virus for good reason, right? This unknown pathogen. And so not only did we see a big uptick in the number of patients coming into our hospitals for the COVID-type symptoms of shortness of breath and fever, but also a big downtick in everything else. And so we cut our visits for things like heart attacks and strokes, things that you wouldn't think would go away, by between a third and a half. And so it really saw big changes in the way people were accessing health and care.
Indeed. We too were following the media coverage suggesting that across the country, patients were staying away from hospitals out of a fear of becoming infected with the virus. That being said, infection control is certainly not something that's new to hospitals, and safety has long been a number one priority for hospitals. And as we've been hearing it, the safety protocols that have been put in place to prevent the spread of infection inside hospitals have become even more stringent since the start of the pandemic. I wonder if you could walk us through some examples of some of the new practices that you've put in place in your health system.
Yeah, you're 100% right. Something I think that's really important is that when this virus hit, we were ready. We were ready, at least for the initial part, that because of Ebola and because of SARS and MERS, we knew that having a novel pathogen wasn't just a possibility, but a probability. And so we drilled for things. We made sure that we had very stringent isolation protocols available for those rare novel infections. So when our first patients came in, we were prepared for them. We used very high level isolation policies. And as the pandemic progressed and we had more and more patients coming in, and we realized over time that this was not typically an airborne problem, but a droplet problem, we were able to start not only dialing back on those Ebola level precautions, but also distributing the broad precautions even more widely. So we went quite early on to universal masking in our hospitals. We went to screening all visitors, limiting visitors, having just one entrance into the hospital, for example, and screening all visitors for symptoms of COVID. In addition, making sure we knew who was coming into our hospitals in case we had to do contact tracing for an unexpected exposure. We disinfect everything in the hospital on a regular basis. We keep patients with COVID together. We call it cohorting by putting them in the same location to minimize the inadvertent risk of cross-contamination. And doing all of this, we've actually, as we look at the antibody studies on our patients and our caregivers themselves, the doctors and the nurses, as well as the housekeeping staff and the cafeteria workers and our facilities, we do believe that we've been successful, although we'll play it out over time, in keeping the virus from being transmitted within our facilities, which is a really critical thing to do.
That certainly speaks to the effectiveness of the measures that you've been taking. Thanks for walking us through that. We know the pandemic is in kind of different phases in different parts of the country, and in some areas, patients are starting that process of resuming their care inside of hospitals. Could you walk me through what a patient might expect to see when they come to a hospital nowadays? What's new or different about their experience?
One of the most challenging things for patients is limiting the number of people coming into the hospital with them or coming into a clinic with them. And so not only will they see the same kind of distance between others like you would see in a grocery store. So you come in and there's a receptionist with a piece of plexiglass in front of them and hand sanitizer everywhere, right? So that little bit of physical distancing that exists in so many facets of our lives at the moment. But also because we're limiting the number of people, if you are used to coming in with your support network, with your mom or your sister or your parent, now we might ask that person to wait in the car. So that's quite different. You'll also be talking to people through a mask because everybody is universally wearing a mask these days in hospitals, even if it's not true on the street in every state. Virtually every single healthcare worker you will meet or everybody working in the healthcare environment knows the criticality of wearing a mask and preventing that droplet transmission. And so we've had universal masking since March within our facilities. So it really is a distinct difference when you can't see people's full face. And so it is not anonymous, but it feels more abstract because you can't read people's expressions as easily. But the care is still incredibly high quality and incredibly compassionate. It just has this cloth barrier between you and the person taking care of you.
Yeah, I imagine for patients coming in, it feels different, and it certainly speaks to the importance of communicating with patients and communities about what to expect when they come to the hospital. Can you tell us a little bit about what Providence is doing to communicate with patients and with communities about hospitals being open and safe places to receive care?
It's been really important to communicate with our communities. We have a number of our doctors are telling us about patients they've seen because somebody started having weakness on the left side and were scared to come into the hospital. And so they missed the window to be able to get clot busting drugs to break up their stroke and keep it from becoming permanent, right? So people sitting at home when they're having a medical crisis allow that crisis to get worse if they don't access care. And so it's really important for us to communicate to patients that it is safe. It is safe for you to come in and get care. And so we've been working with a broad community and including the American Hospital Association to say now we know we need to socially distance, but we should not medically distance from each other. And so that if you need care, if you have something chronic, if you have diabetes and hypertension and asthma, make sure that stays under control because you don't want to go in for a stroke and a heart attack and pneumonia right now, right? So socially distance good, medically distance bad.
I love that phrase in terms of social versus medical distancing. One of the mechanisms that we know hospitals across the country have been using to sort of reduce that medical distance between them and their patients is telehealth. And I know Providence has done an enormous amount of work to expand its telehealth platform. Could you tell us a little bit about that and what prompted the need for it and why you decided to invest in it?
Well, we have believed that telehealth is the future of medicine for the past decade. And apparently we just saw further into the future than we thought we did, expected this to happen 5 years ago. That said, when we got the first few patients and we realized that this was going to blossom and become something much bigger, we knew we had to sort out a different way. That if what those initial projections looked like, that we had a huge number of people very rapidly with fever, cough, shortness of breath coming into our doctor's offices, that we would rapidly be overwhelmed. And so we decided that we needed to figure out how to move knowledge, not people. How could we get care to where people are rather than require people to come into where care is? And so we used the tools we had already built within telehealth and started making sure that they were available to people on demand. So we, back in February, worked with Microsoft and our digital team to build something called a chatbot, so that if you Googled on, do I have COVID, you would go through this list of questions that this chatbot would help you ask and answer, and then could direct you to say, no, you're okay, or yes, you have symptoms consistent. Would you like to have an on-demand visit right now? And immediately transfer you over to an Express Care virtual visit. And that Express Care virtual visit, you'd actually have a face-to-face encounter virtually through a FaceTime-like application with a provider and who could decide. And at that point, you had to have an appointment to get a test because tests were in such short supply. So we could get people an appointment, get them tested. And then we also set up that if you did have COVID and you were at risk, but you weren't super sick, you didn't really need to be sitting in a hospital bed, we set up a home monitoring program so that we could watch people in their home. We'd send them home with a thermometer and a pulse oximeter and allow them to be monitored from the comfort from their own home, keeping them safe, but also keeping eyes on them virtually. And so by doing that, we went in 2019 from having 70,000 visits during the entire year through telehealth to in 2020, by April, we were doing 70,000 telehealth visits in a week. So it was a dramatic scale up. But what we found is that patients love it. And actually doctors love it too. It's easier and convenient for everybody. It's not perfect for everything. Obviously, you're not going to take out somebody's appendix if that's the problem. Telehealth is not the right application for that. But there's a whole lot of healthcare that telehealth streamlines and simplifies. And who doesn't want healthcare to be easier?
Exactly. It sounds like telehealth has been a tool not just to deal with the pandemic at hand, but to really go beyond the pandemic and deliver care in new and innovative ways. You talked about the home monitoring approaches that you're using to treat patients who have COVID. What other benefits have you seen outside of COVID patients in expanding telehealth?
Well, all those patients that I mentioned earlier that were really worried about coming in, that if they're older and they're afraid that COVID might be lethal for them, well, they don't want to come into the doctor's office, but they still need their blood pressure taken care of and their diabetes managed. Well, telehealth is a great solution for them. Or for parents who the kids are home now, nobody's in school, they're trying to juggle between watching these elderly parents that they don't want to take out of the house and these kids that they can't leave behind. So for them, it's a great solution. So it really is incredibly convenient. It's safe in this time when people are worried, and it's much more convenient. So it's a true enabler of making our vision at Providence is health for a better world. Leveraging telehealth is one of those ways to truly increase the accessibility and affordability of great care for all. So I see it as something that is here to stay. I cannot imagine the community letting us roll back the benefits of telehealth in the post-pandemic world.
Yes, indeed. And Dr. Compton-Phillips, thank you so much for sharing your insights and experiences in grappling with the pandemic and with providing safe care in the midst of the pandemic. And according to the CDC, chronic diseases affect 6 out of every 10 adults in the U.S., and in fact, 4 out of every 10 adults in the U.S. live with 2 or more chronic diseases. And so the decisions around postponing essential care do have some serious health implications for patients. And thank you for helping us understand how hospitals are making sure that patients do get that needed care in this unprecedented time.
Well, I really appreciate you having me on. I think it's during this pandemic, the public has realized what a critical function hospitals play. And so I think we owe a huge thank you to the healthcare heroes that have been working in our hospitals, as well as the communities that have been supporting them. So thanks for calling that out today.
Thank you so much.